Hey, Dr. Tom here. Neck pain is not always about stiffness, tightness, or strain in your neck, but sometimes it's a sign of something more serious and should absolutely be considered a significant health issue. Today, let's cover some simple red flags that point to a neck disc bulge or herniation. But first, let's cover a quick anatomy lesson and what is a disc. Think of a disc like you have cartilage in your knee, hip, or shoulder. These discs of our spine separate each and every bone of our spine, and at each level allows for the proper passage of the nerves that exit off your spinal cord and that feed the rest of your body. And think of this disc like a jelly donut. You have this tough, fibrous outer layer of the disc, but literally a jelly-like substance sitting at the core of the disc. And when we lose normal structure and or function of the spine, what happens is that outer layer becomes brittle, starts to crack, and allows that jelly-like core to push its way through the outer layer. And the disc bulge, the more mild version of a disc injury, is where that core layer starts to push its way and cause a bulging of the outer layer. And a disc herniation, the more severe version of a disc injury, is where that center core pushes its way all the way through the outer layer. And in a disc bulge or herniation, it's going to go one of three directions, either going left, right, or backwards. But unfortunately, there's ultra-sensitive nerve tissue sitting in each of those directions. So what are simple red flag symptoms that point to a disc bulge or herniation in your neck? First would be pain into your arms, hands, and fingers. And that pain could be dull, achy pain, throbbing pain, shooting pain. And where you feel the pain will depend at what level of disc injury that you have. Most commonly, it's going to be a C5 disc injury, more mid-lower neck, and that typically will feed shoulder to elbow. Then your C6, C7 disc, more that lower neck, feed into your forearm, hands, and fingers. Second would be tingling and numbness in the arms, hands, and fingers, again, depending on what level of disc injury, but most commonly, people are going to feel these symptoms into their hands and fingers. And third would be loss of grip strength. Now, each of these spinal nerves controls both motor or muscle function as well as sensation. So it can cause problems like pain, tingling, numbness, weakness, or any combination. Doesn't mean you can have all those symptoms, but once that nerve gets irritated, it opens the door for those problems to exist. Now, this is important because not only are these the nerves that feed into your arms, hands, and fingers, but they also feed into the vital organs through your head and neck. And these pain and symptoms may worsen depending on your position. So whether you're sitting, laying down, looking down at your phone, and you may also notice a change in strength or weakness, as well as coordination and balance issues. So when is it time to seek care? I've been doing this for 28 years. So once you've noticed problems with the arms, hands, and fingers, you have a problem. So go get it checked, because it's a sign that a nerve is getting irritated. And certainly if you notice any recurrence of symptoms, doesn't matter how often they're recurring, all that matters is that they are recurring. And my best recommendation is to go for x-rays of your spine, both upper and lower spine, because what I've noticed over the years that if you have an upper spine problem, that there's a good chance that you have a lower spine problem as well, regardless of any symptoms or lack thereof. And the x-rays that I love to do are motion study x-rays. So we're going to do our typical straight on and side views, but then we do two with movement. And here's where I can see what joints are moving normally as opposed to what joints are not moving at all. And then we can use that information to put our best treatment plan together to fix the cause of the problem. And here's what not to do. Do not rely on pain medication or passive treatments to fix the problem. Numbing the pain and symptoms to get through a day is one thing, but will do absolutely nothing to fix the problem. The majority of these disc injuries are a result of a mechanical breakdown of your spine, and the only way to solve it is with a mechanical solution. The good news is that most disc injuries can be solved at home with the right tools and procedures put into place. If you're ready to take the first step and get the ball moving, sign on to our 5-day spine reset and implement this into your daily routine. If you're ready to start solving your disc injury ASAP, go over to our website and schedule a complimentary 15-minute discovery call, and let's see how we can help you. If this video helps you, hit subscribe. I post new spine rehab content every week, and drop a comment below which red flag do you relate to most.